Everyone wants to feel safe, and we are proud to do our part for both our customers and those on the front lines. Should you need to service or purchase a vehicle, visit our websites for the help you need. Together, we will get through this.
Good morning, everyone, and welcome to the Edinburgh Chamber of Commerce first Public Affairs live stream. Today's topic will be COVID-19 Healthcare Forum. My name is Mario Liscano. I'm the Administrator of Corporate Affairs for DHR Health, and I serve as the Vice President of Public Affairs for the Edinburgh Chamber of Commerce. We'd like to welcome each one of you that are joining us today, and due to our pandemic, we are not having our regular luncheon, but because of the importance of our message, we were glad that the health systems and our government leaders were able to join us today to pass on this very important message. First of all, I'd like to take this opportunity to thank the City of Edinburgh, our Mayor and City Council, our Edinburgh EDC for their support, and we are thankful for allowing us to assist today in providing this service. First of all, as we start, we ask you to continue to keep all our community and our families in your prayers. We will be bringing up our Executive Director, Ronnie Laralde, who will provide the acknowledgement of our sponsors and also provide the messages from our special guest. With us now is our Executive Director for the Edinburgh Chamber of Commerce, Ronnie Laralde.
Good morning. Thank you, Mario. With the COVID pandemic limiting movement and disrupting the economic activity, we were planning this live event weeks ago thinking that this would be a post-COVID event. Little did we know that this was in the heat of the moment. Our cases are rising, and we're glad that everyone of our health officials that are participating, our government officials today. I would also like to thank our businesses that, even though of this time of hardship, they stepped up and they wanted to be a part of this event, very informative event for our community. I would like to thank Bird Ogden Auto Group, our title sponsor, and I would also like to thank a few other of our partners, Magic Valley, UTRGV Health, and of course the City of Edinburgh and the Edinburgh DC. Right now, we're gonna have a message from our sponsor, Bird Ogden Auto Group.
Over the last 6 weeks, the Bird Ogden Auto Group has taken many rigorous measures to ensure the health and safety of our guests and our team members. We'd like to thank each of our employees for their flexibility in adhering to each of these new policies, as well as each of you for adhering to local and state guidelines. While we are encouraged to see restrictions loosening, our local economy opening up, and people getting back to work, we have made the decision out of an abundance of caution to maintain our enhanced safety protocols. That means when you visit one of our facilities, you will continue to see our team members wearing face masks, and we'll ask you to do the same for both your safety as well as ours. We will continue to be innovative in finding ways to serve you, and we encourage you to utilize both our home delivery and curbside service for your convenience. Finally, we'd like to thank all of our frontline heroes who have tirelessly worked to protect, serve, and feed the families of the Rio Grande Valley. Thank you for all that you do.
Thank you, Natasha and the Bird Ogden family. We appreciate your support. Right now, we have Senator Juan Chun Hinojosa. Senator Hinojosa represents District 20, which runs from Hidalgo County up to Nueces County and Corpus Christi. Senator Hinojosa has held public office for almost 40 years, first in the Texas House of Representatives and then in the Texas Senate, where he has served up to since 2003. Senator Hinojosa had a conflict with being here in person, but he wanted to make sure he participated in this event, so he sent a short video that we'll be playing right now.
Very important conference to provide knowledge and information to the public about the great challenges we are now facing with this pandemic, COVID-19. First of all, for us as a state, we are moving pretty quickly to provide help and assistance to our local communities. I know working with the federal government and the state, the county of Hidalgo has received $151 million to help with costs that are related to expenditures made by our local governments and hospitals on coronavirus-related expenses, which is important because many of the cities, certainly many of the hospitals were not prepared or budgeted for this unexpected pandemic. But as we work together as a team trying to address the many challenges that we have, we also need to be careful about the way we behave. Having to wear a mask in public, washing our hands, and having social distancing. It's important that we follow the guidelines that are set by the CDC to make sure that we all obey and take care of ourselves as a community. And also let me point out, this pandemic has been devastating all across the board, not only to our health threats that we face, but also to our economy. I know many of our businesses are shut down. Many people are unemployed, but we have moved very quickly to provide unemployment benefits, provide support, and try to focus on those jobs that are still available, on those new jobs that will be created, and provide the necessary support to our workforce to be able to come back to work when it's safe. Having said that, for us as a state, as we prepare for our next session, we face quite a few challenges to our budget also. We are already experiencing a deficit of approximately $3 billion from the budget that we passed last session because oil and gas and the sales tax, two of the main revenue sources for the state budget, are really underperforming due to the pandemic, but also due to oil and gas prices crashing worldwide. So we have many challenges, but keep in mind that as far as education is concerned, we the state will continue funding 100% of our commitment to public education. And those challenges are many for the simple reason that our schools are shut down. We're trying to provide long distance learning. So this coming school year, we'll also be providing the proper support for our teachers with the proper training and proper equipment to have long distance learning available to many students who, for whatever reason, are not able to attend school. And as we face these challenges together, keep in mind that we are one community and we work as a team. Our county judge, Richard Cortez, our mayors, our state, our congresspeople, we are here to provide support to the public and provide the resources that we have as a state, as a county, as the cities, to make sure that we keep our community safe. So thank you so much for letting me share a few words with you. And I know that you will hear some very useful information from our panelists who are also very much involved on a day-to-day basis on the challenge that we face in fighting coronavirus, making sure that our families practice proper health practices as washing our hands, social distancing, wearing face masks. I know those little things make a big difference in terms of trying to stop the pandemic from being transferred to other people and spreading it all over the place. So please cooperate, please help, and again, thank you so much for allowing me to share a few moments of my time with you. Thank you.
Thank you, Senator Hinojosa, for that message. We hope you are well. Next, we'll have Senator Eddie Lucio Jr., State Senator representing District 27, which runs from South Padre Island to Kingsville and includes parts both Cameron and Hidalgo County. Senator Lucio has been in public office almost 50 years and has served in the Texas Senate since 1992. Next, we have Senator Eddie Lucio Jr.
Good morning, everyone. It is a pleasure to join you today in this most important event. As news outlets and the State Health Department have reported, we are continuing to see daily increase in COVID-19 cases and hospitalizations across our state. Locally, as our local hospital panelists can share, the sharp increase in cases is straining our ability to maintain our local public health capacity. Before I continue, I would like to take a moment to commend our hospitals, our doctors, and our medical support staff for working tirelessly around the clock to protect our constituents. As one of the senators representing this region, I thank you for being in the front lines fighting to save lives each and every day. In the last several months, during most trying, unprecedented times, we have seen communities in the Rio Grande Valley, from Brownsville to Mission, come together as one region. All of us are working together to increase the resources, attention, and assistance for our Valley community. No one, absolutely no one, has failed to act. Everyone is actively doing their best to communicate with our state leaders on what additional help and resources our region needs to keep our constituents safe and healthy. If you hear otherwise, consider the source. Either they are uninformed or misleading us all. I can honestly say that Senator Hinojosa and I are in constant communication with our state leaders on the needs of our communities. We are in weekly calls with Governor Abbott and Lieutenant Governor Patrick and their staff, as well as with the heads of state agencies like Chief Nim Kidd from the Texas Division of Emergency Management, and my dear friend Commissioner John Hillerstedt from the Texas Department of Health Care Services. Our message is clear. The Valley needs help to keep the families in our region safe and healthy. Just last week, I released a June 25th letter I sent to Governor Abbott, in which I argued that the Rio Grande Valley, an underserved border region, is in dire need for greater personal protective equipment, increased free testing, additional financial help, and more resources, including greater local control authority. I wish the media had covered that letter, because our border region is economically challenged and our local economy has been devastated. We have unemployment rates that far exceed those of the state of Texas. We do not have the tax base to provide the critical resources that are needed to address the soaring COVID-19 outbreak. Our state leaders need to know that unlike Dallas and Austin, we do not have the tax base to finance locally the creation of isolated environments to expand our capacity, or to retrofit, renovate, or build facilities to keep up with the surging outbreak. Our border economy is dependent on trade and commerce, which has been devastated by the pandemic. We need Texas to help, knowing that the surge of COVID-19 patients has resulted in more than a 500% increase in hospitalization in our local hospitals. The time to act from the state is now. We need for the governor to make it a priority to dedicate funds at his disposal, be it Federal CARES Act funding, unexpended general revenue, or the rainy day monies that we have available. We need him to take action and send critical funds where they are needed the most to our Valley hospitals. The rising tide of coronavirus patients is straining our public health system, and we need to get the message out. We need all of our local resources, including our Valley media, to partner up with us so that our state leaders hear our call for help. Just like the issues outlined in my June 25th letter to Governor Abbott, thinking proactively, we also need our congressional delegation to continue to flex their power in Washington. We need to ensure that future federal New CARES Act funding includes a direct allocation for underserved communities like the Rio Grande Valley, and especially for our Valley Hospital regions across the nation with emerging populations of racial minorities, which predominantly have shouldered the brunt of the pandemic, and that lack a local public health care district need to have dedicated funding. Why? Because that is where the help is needed the most. Being proactive and unified with the best interests of our region, we can ensure that we have the necessary funds and resources to have the necessary healthcare capacity to be able to take care of COVID-19 patients along with non-coronavirus patients. We need to be able to have isolated environments to protect the most vulnerable populations. And we need the necessary resources to support the socio-economic recovery of underserved regions like the Valley. Finally, it is inspiring to see our communities are coming together to combat the public health threat that is wreaking havoc throughout the nation. To see our county judges work hand in hand, to hear our mayors jointly passing ordinances to be among the CEOs of our hospitals developing healthcare capacity solutions, and to read about our congressional delegation echoing the sentiments that Senator Hinojosa and I have been sharing with our state leaders. Truly, our region has a unified front against the coronavirus outbreak. May God bless us all. Thank you.
Thank you so much, Senator Lucio, and thank you, Senator Hinojosa, also for your commitment to our community and all your efforts that you do. We greatly appreciate you, and we greatly appreciate your efforts. At this time, I'd like to introduce our moderator that will be coming up to help us with these questions. And thank you, Senator Lucio, for bringing up the fact that we do have our health systems here present. The incoming president and also former state representative, Ms. Veronica Gonzalez, for the incoming president for the Edinburg Chamber of Commerce, had led these panel discussions, and they are now where we're seeing them being joined by a lot of our regional audience and not just the local audience. So we thank her for her effort, we thank her for her leadership, and then above all, we thank her for being our moderator today and for making sure that we bring this statement home, which is we all need to work together. Thank you.
Good morning, everyone, and thank you for joining us today for this important discussion on healthcare in the Rio Grande Valley and more specifically on COVID-19. I know many of us have grown tired of hearing about COVID-19, and we think that we know all there is to know about this virus. But the current situation is dire, and it requires that we not let our guard down. In fact, we have to be more careful than ever to keep this virus from spreading. Hopefully today's session will tell us why and teach us something that we didn't already know. It's obviously a critical topic when you can get 3 top executives from local hospitals with us, the Dean of the School of Medicine, and our 2 state senators. Thank you all so very much for being here with us today. And we want to especially thank your frontline workers who are out there testing and who are out there treating all of the patients that are coming into our offices and hospitals. Before we get into the discussion, let me introduce you to each of our panelists. You already met, of course, our senator, and he didn't need any introduction, and of course, Senator Hinojosa, but we have with us Chris Rivera, who is the first Hispanic female executive to assume the position of CEO of Rio Grande Regional Hospital in McAllen. Chris is a native of Edinburg, and after having worked in various healthcare executive roles in Louisiana and Kansas, she and her husband David returned home in 2012, and she has served as the CEO since that time. Thank you for being with us, Chris. Dr. Carlos Cardenas, also a native of the Rio Grande Valley. He is a gastroenterologist in Edinburg and is one of the founders of Doctors Hospital at Renaissance, where he has served in various roles, including CEO and now as chairman of the board. Thank you, Dr. Cardenas. Mr. Lance Ames, who is CEO of South Texas Health System in Edinburg. South Texas Health System includes Edinburg Regional Hospital and Edinburg Children's Hospital, among others. Lance previously served as Chief Operating Officer of the hospital, and before that was interim CEO of McAllen Heart Hospital. Lance has been in the Rio Grande Valley since 2013. Thank you, Lance, for joining us today. And last but not least, Dr. John Krause, Dean of the UTRGV School of Medicine and Executive Vice President for the College of Health Affairs. He's a head and neck surgeon, and prior to coming to the Rio Grande Valley, held executive positions at the Lewis Katz School of Medicine at Temple University in Philadelphia, Pennsylvania. He holds a medical degree, a PhD, and a master's in business administration. We were fortunate to have him join the UTRGV School of Medicine in 2017. Thank you, Dr. Krause.
Thanks, Veronica.
So, Dr. Krause, let me start with you. Texas has made national news with reporting over 7,000, close to 7,000, very close to 7,000 new infections in one day. The number of positive cases in the Rio Grande Valley has gone from 15 to 20 a day at the start of June to several hundred a day. To what do you attribute this spike?
Well, thanks, Veronica, and thank you for inviting me here today. You know, we needed to get the economy open again. There was no question about it. It was important for Texas to do this. But it seemed as if when that happened, many individuals just did not pay close attention to the guidance they were being given, and the guidance about the importance of social distancing, the importance of wearing face coverings. And people began to congregate in groups, in large groups without these kinds of protections at beaches and in nightclubs and in other areas. And I think getting people back together in those kind of close circumstances without the appropriate protection really set the stage for this virus to begin to grow again and grow rapidly. It has. So it really has to do not so much with opening the economy per se, but with the failure of people really to take personal responsibility for keeping themselves and others safe.
And I think that's especially important to say right now that we're coming up on the 4th of July weekend and people want to congregate. A few months of following the rules is going to save us a lot of heartache and a lot of sickness. So thank you for that. I know that UTRGV has 4 testing sites throughout the Rio Grande Valley. How are the testing sites keeping up with the recent demands?
The demand is growing really quickly, Veronica, and just to put it into perspective, a month ago we were hearing about 1,000 calls a day at our call center around COVID-19. We're testing about 100 or so a day. That's gone up more than tenfold. We're now receiving 12,000 calls a day at our call center about COVID-19. And we're testing now for about 1,000 samples across the valley on a daily basis. We're finding that we need to continue to add personnel. We need to continue to add lanes so that we can do more drive-through testing. So we are working diligently to keep up with it, but it's been a struggle in that no one could have anticipated this much of a rapid change or this much of a growth in such a short period of time.
And we've all heard the term contact tracing.
Mm-hmm.
Would you tell us how that works, and also what is UTRGV's role in contact tracing?
Thanks. I think if you really want to get this disease under control, once you have a positive test, you really need to be able to find out where that person has been, who they've come into contact with, and then you need to test and isolate those individuals as well. And that's how South Korea and other areas were really able to get this under control more rapidly. So UTRGV actually has a contract with the State Department of Health Services, and we receive contact tracing assignments not only from the Rio Grande Valley, but from across the state. So we have a group now, and that group is expected to grow to 300 over the next year in order to really try to find people early, isolate people early, test them. And if you can do that, you really can keep people from spreading this in the community, because we know that people can spread the disease even when and if they don't have symptoms.
Thank you, Dr. Krause. And now I want to move to our hospital administrators. Governor Abbott has repeatedly said that medical experts and the state are closely monitoring the hospitalization rates and the capacity at hospitals and that they use that data to determine what we as residents and businesses can and cannot do. We all know that the hospitalization rate has been increasing significantly. In the Rio Grande Valley, the rates from May to June went up. I saw one report 743%. And just yesterday, I heard Mayor Mendez say that over 1,300, there's been a 1,300% increase in the lower Rio Grande Valley. So my questions to each of you are, what is the current hospitalization rate at your hospital? What does it look like? And how concerned are you that your hospital will run out of beds, staff, and necessary equipment to treat our COVID-19 patients? And the second part is, are you having to divert patients already? And if so, where? I'd like to start with you, Chris.
Thank you, Veronica. Again, my name is Chris Rivera. I'm the CEO at Rio Grande Regional Hospital. I am your CEO. And the reason I say that is because I want to share with you a comment and let you know that all of us as executives, as leaders of our various health systems, leaders of UTRGV, and of course our state senators, we're all here and committed to improve your health. However, at this time, we do need your help to be able to address these issues that Veronica just mentioned. So for Rio Grande Regional Hospital, we're working very diligently to make sure that we've separated our COVID-19 patients into those respective units so that we can also take care of the rest of the population that needs the different type of care, either heart attacks, strokes, babies that are still being born, appendectomies that still need to occur. So we have to be very diligent on how we manage that. And right now, as far as the hospital capacity is concerned, we are at about 80% on our capacity. We have had to go on diversion in order to ensure that everyone coming through our doors is being properly cared for, placed in the right units, and our personnel are able to take care of the care needs of each and every patient that comes through. But with their efforts, especially the dedication of our nurses, our respiratory therapists, our physicians, on our medical staff, and everyone within the hospital is very dedicated to making sure that our patients are well taken care of. Thank you.
Thank you, Chris. Lance, how about at your hospitals?
Thank you very much. First of all, I would just like to thank everyone and recognize that we have very strong leadership across the county. It's been inspiring to see all of the hospitals coming together more than we ever have and working together to realize what the barriers are to care right now and seeing how we can solve them together with our county and state leaders. At our hospitals with South Texas Health System, we have also seen the hospitalization rate more than double with COVID-19 compared to our initial surge that we saw around March. We have seen an increase just in the past week and a half or so that is just unprecedented. Our resources have been definitely challenged, as have all hospitals across the area, and we have also had to be on diversion during certain days of the week based on the capacity or the number of patients coming in at any one time. It's very inspiring also to note that we've had wonderful preparation by our leaders within South Texas Health System. We have a team of physicians that is also guiding every step of the way how we're responding to this event. We prepared, starting really closer to the beginning of the year when we started seeing surges, by procuring more PPE for our staff, for our physicians, for everyone in the hospital. We have a pretty good supply of PPE right now. We also have increased our numbers of tests. We use both the BioFire PCR testing as well as the Cepheid testing. And we have a good amount of tests for our inpatients and ER needs at this time. And so a lot of kudos goes to our team for just making sure that we have the resources for our community and that we're prepared. With that said, our biggest limitation right now is probably staffing. With beds that, we do have a few beds that are open, but they're mostly open because we need more staff. And so we fortunately this week did receive good news that the state was able to send some more nurses down to help support our community. And we are getting around 30 nurses right now screened and tested to make sure that they are ready to go, but they will be an additional resource to our hospital to help us increase our capacity. And that's really the biggest need right now, is just having the manpower to be able to take care of our community the way that we need to. But we are still a safe place to be. We have all the safety precautions from universal masking to social distancing to even having UVC light capability within our hospital to sanitize rooms and keep our air, even through our air handlers, clean. So a lot of good work is being done, and we're proud to be able to be here in the community to serve, especially during a time as challenging as this.
Thank you, and thank y'all for all that hard work. I know it's round the clock. And Dr. Cardenas, how are things over at DHR?
Well, first let me say thank you for having us here this morning, and I share with my colleagues the real concern that we have moving forward through the COVID pandemic. We prepared for this. DHR, we were prepared, and we prepared early by creating a separate ER facility where we would see strictly people with respiratory symptoms and determine who had COVID and who did not. In addition, we were able to convert a unit and retrofit it and make it work as a separate facility, what we call our serious infectious disease unit, specifically set up to handle COVID. And in addition, added a second unit as well. I wanted to give everybody a little perspective. Prior to Memorial Day, we were down to where we had no patients in our COVID units. None. Today, we have seen an hospitalization rate into the COVID unit increase by 1,300%. That is an alarming figure. That's a lot of people. Our units are approaching capacity. We need increased capacity, and I think I speak for all of my colleagues today when I say that we all need increased capacity, and all of us are feeling the strain that's reflected in the faces of our frontline workers because they need relief, and that means nursing staff. We received notice this morning, or yesterday evening, that we have some relief staff heading our way, and that's a good thing. But we stand ready with all of the measures that we have put in place, and we're doing our part. And I think it's appropriate to ask the public to do their part. Follow the rules that we've been talking about. For those of you who remember what a vinyl record is, I sound like a broken record when I tell you to wash your hands, wear a face covering, maintain social distancing, limit yourself to activities that are essential, and don't congregate, don't come together. For the Valley, that's difficult because we are a pachanga culture. It's very difficult, and I understand that. But we need to do these things because these are the measures that we can all use to help us control what's very rapidly unfolding in front of us.
Thank you, and thank you for that good advice. You notice we're all wearing our mask here, and I think we all realize how important that is to protect us and to protect others. Dr. Krause, let me ask you this. We've been hearing about how the economy is devastated and how people want to get back to work. But if we're going to try to get back to work and to schools, is mass testing the answer?
You know, Veronica, I think it's a very good question. I'm not sure it is, and I'll say that for a couple reasons. I think in certain circumstances it makes sense to test on somewhat of a regular basis. I think if you're in a healthcare setting, there's a reason to want to make sure that the employees are safe and not infected. But realize that you could test to be negative today, be at an event tomorrow, and now become positive. So it's not really practical to be testing people weekly, the entire population. So I think it gets back to what Dr. Cardenas said. The best way we get this under control is not with mass testing. It's with people becoming very, very diligent with the practice of precaution, with hand washing diligently, with wearing masks anytime you are about to come into contact with anyone, and by maintaining good social distancing. So the answer is in the public's behavior. It's not in mass testing.
And, you know, you hear everybody seems to know someone who either has COVID or has been exposed to COVID. If you've been exposed to someone with COVID-19, how soon after exposure should you test?
Well, I think what we're telling people to do is to self-isolate for 14 days. I think that's still very good advice for most patients, most individuals. You probably want to be tested at about 4 or 5 days after exposure. You're not going to develop a positive test in the first day or two, but people tend to develop symptoms on average at about day 5, but it can be later than that. So our advice to people who call our center when they've been exposed is to be tested on around day 5.
Okay. And we've heard also about antibody testing that tells us if we've had the virus and have some immunity. Do you recommend that it be done by businesses, for instance, that want to bring their employees back to work?
You know, antibody testing, Veronica, is one of those areas I think is still not well understood. We certainly have the capacity. We do that testing in our lab, but we're not quite sure what the results mean. We don't know that if someone has antibody that they truly are immune or not, and if they are, how long that will last. So I think at this point, until we have a better grasp of what a positive IgG antibody means, that it's probably not wise to do mass testing on antibody for diagnostic or decision-making purposes.
Okay, and we've also heard about rapid testing. How does that differ from the diagnostic testing where they use the Q-tip, I guess the long Q-tip up your nose, and the antibody testing that requires blood being drawn?
Again, there are a variety of tests available. They have different accuracy rates. If you really want to diagnose the most accurate, in the most accurate way for the presence of virus, it's with PCR. And what's happening there is you're actually doing a swab in the nose generally and gathering mucus from the nose and testing it for the genetic material from the virus. And the presence of that genetic material will tell us that that person has that virus in the nose or in the mouth. There are other tests that are done with swabs. There are saliva tests that are becoming available. They're becoming better. But for the testing of whether or not someone's positive, we would much rather do a PCR, look for the genetic material, than look at serology or antibody testing.
Okay, and so if we're going to get back to work and if we're going to get back to school, how do you bring your employees or children back in a safe manner?
No, yeah, I think that's a very challenging question as well. I think, first of all, and at the university, we have looked at this question in great depth. It's where people can work from home and do that successfully and productively, then people can and should work from home. Where people need to come back into some sort of a face-to-face environment in order to be productive, that can be done in a phased manner. It can be done with various shifts that are done. And certainly there are things that you can do in order to screen those people at point of contact. You can screen them for symptoms, much as we were done when we entered the building here today. Temperature checks are available, and those can be done in a rapid way to make sure that someone does not have a fever. So I think if you're screening people on the basis of those kinds of simple things, you will eliminate almost everyone that has active coronavirus. But again, there may be a few people who are asymptomatic who can be carriers. I think at this point, using those kinds of common sense principles are the best way we can get back open again.
Okay, and I've got one other question for you. We've heard Dr. Fauci and others talking about a vaccine. In your opinion, how far are we from a vaccine that would be readily available to the public?
Again, wish I had a crystal ball on that one too, Veronica. I think Dr. Fauci is now saying that early 2021 we may have something available that would be useful. The problem is not availability of having a vaccine. That's one issue, of course. It's then scalability. How can you scale up production in a way that it can be available to the population at large? I don't think we're close to that point, and that's probably a year or so away. So again, until that time, we're going to have to practice these diligent kinds of safety measures that we've all been talking about here this morning.
Thank you so much. Chris, you mentioned earlier that people go into the hospitals for more than just COVID-19. Women go in to give birth. You've got all kinds of surgeries, appendectomy, for instance. I understand that you've been asked frequently whether hospitals and the emergency rooms are safe to go to. What would you say to that?
Thank you, Veronica. Well, what I would say to that is that our emergency departments are absolutely safe. We've got personnel that wear their protective equipment in order to make sure that they protect themselves and they protect the patients that are coming through. We also have identified it within our emergency departments, those areas that are designated for suspected COVID positive patients and those emergency room areas for patients that are not suspected or do not present with symptoms of COVID-19. So we work very diligently to separate the two in order to ensure that we do have a safe environment for anyone coming into any one of our emergency departments. And I too, Veronica, want to add that I'm very pleased on how each of us within our health systems here in the Rio Grande Valley are working together to be able to take care of our population. Thank you.
Thank you. And Dr. Krause was talking about when you should test if you think you've been exposed. When should a person that suspects that he or she has COVID-19 go to the hospital?
Well, I think it's important for the population to know that if they do have symptoms and they do suspect that they are probably COVID positive, that they reach out to their primary care physician first and foremost. And or they can also reach out to urgent care centers, our freestanding emergency departments, and if necessary, definitely to the main emergency departments in each of our hospitals. I think that it's important that the general population understand that we are here to serve, but we also don't want to cause a bottleneck in any of our emergency departments, and we definitely need to address and take care of universal precautions. Dr. Krause said something very important. He said it's very simple, and we need to use common sense in ensuring that everyone does do their part in trying to reduce the spread, and that's by universal masking, as he mentioned, hand hygiene, social distancing, and staying at home if possible, unless there's essential work that needs to be done.
Yes, absolutely. And it's obvious, COVID-19 is not going away tomorrow, and it may be a long time before we have a vaccine. So how do you think that COVID-19 is shaping healthcare delivery in the future?
It already has started shaping it now, matter of fact, Veronica, because we have had to ensure that our protocols, our processes, the medical care that's being provided is based on evidence-based medicine, and right now that information is still being gathered by our scientists throughout the nation. We are working very closely with the Center of Disease Control to ensure that we have the proper guidelines, proper protocols in place, and for the care of the patient, the care of our employees. So it's definitely taking shape now, and definitely will continue into the future.
Yes, I've noticed, in fact, that a lot more telehealth is being used by hospitals and also by doctors' offices. So thank you for that, Chris. Dr. Cardenas, we've been hearing about a Health Institute for Research and Development that DHR has, where people who have had COVID-19 can go to get their plasma removed in order to help current patients with COVID-19. Can you tell us more about this?
Sure, that's a very exciting development. Early on in this pandemic, it was identified that individuals who have had the virus and recovered would have circulating antibodies in their bloodstream, and that those antibodies we could obtain by obtaining plasma. Plasma donation is something that's been with us a very long time. To be able to use plasma donation as a treatment and therapy at DHR and other facilities that are participating in a multi-center trial using convalescent plasma has been a real boon for us to be able to provide that. We've been working together with UTRGV and other facilities across the valley to make this possible. However, the plasma doesn't grow on trees. We need those individuals who have been ill with COVID-19, have recovered, and are feeling well and doing well to go donate plasma. So this is a plea to the public, for those of you who have recovered from COVID, to volunteer and give your plasma, because that may help to help someone who's already very ill with COVID-19 to potentially get better and participate in that important research study. Besides plasma, we're also using remdesivir inside a trial and outside the trial, as it's been made available. It's in short supply, but as it becomes available, we're using it as a therapy as well as other therapies that are coming to light, including dexamethasone and other therapies that are coming to light. And the research is an ongoing part of it. The only way we can lick this in the end is to continue to learn about it. And the more we learn about it, gives us the weapons that we need to be able to address the problem in front of us.
So I guess then, if you've had COVID-19 and you've recovered, they should contact the Health Institute for Research and Development, and then you will tell them if they qualify to give plasma. Is that correct?
That is correct.
Okay. And then, is there a difference in immunity levels for those who have had the virus?
Well, what we're learning about it is that immunity is something that's still being determined. We are obtaining the plasma in those patients who have recently recovered, and that has been useful in treatment. How long antibodies actually last continues to be a matter of question. What we do like, what we want to ask the public is, if you've been infected and you've recovered and doing well, that you contact us to see about donating plasma so we can participate and have you continue to participate and help us to help people who are in the trial.
Great. And in fact, I guess because we don't know what level of immunity someone might have, we also don't know for sure that you can't get COVID-19 again, right?
Well, that's the other part of it. And there's some studies that have shown that there may be some waning of antibodies. And so for how long and the immunity will last is still being determined.
And I guess that's why it's so important for all of us to continue to practice social distancing, wash our hands, sanitize our areas, all the things that we've been told, keeping the 6 feet apart.
Absolutely.
And I've read that people that have had COVID-19, even with a few symptoms, can end up with some long-lasting effect. Do you know anything about that you can tell us?
Sure. So there have been a number of reports that there are people who have continued to have pulmonary issues long-term. There have been a variety of areas that are still being studied as to what the long-term effects may be. There are some individuals who appear to have the illness and that the illness course continues unabated for long periods of time. We've learned a lot of things about how to treat patients, and we know that trying to avoid putting someone on a ventilator, for example, for as long as possible helps in the recovery of that person to the degree that we can help them. Lying them on their stomach in the prone position is something else that we've learned early on that really helps these patients. So there are things that we're learning about this every single day. And I think that research is, of course, in this age of digital media, we've been able to communicate with centers from across the valley and the state and the nation, in the world for that matter, to learn from each other and from the experience of other populations that we can apply here.
Thank you. We learn something new every day about what works, what doesn't, and what comes next with this virus. Lance, you're the CEO of a hospital that includes a children's hospital. Have you seen many cases of COVID-19 in children in your hospital, and how do parents best protect their children?
Yeah, so we have seen a significant increase in COVID-19 hospitalizations, even at the Children's Hospital. And, advice to parents, as a parent, it can be a really scary thing to know how to keep your kids safe during a time like this. And the answer is honestly very simple, just as everyone's been saying, is to really talk with your kids. Spend some time to answer their questions about how we prevent the spread of COVID-19. And sometimes you'll see, even walking around the stores, a parent may have a mask, but the kids don't. And so we need to make sure that kids above 2 are wearing a mask, and so that they can avoid that spread. Kids like to touch their faces, and so even teaching them about behaviors about not touching your face and trying to keep your hands to yourself helps a lot. Teaching them about keeping physical distancing. Everything that we've been talking about here is very relevant to our parents. One thing that, as we talk with pediatricians, is we see a lot of parents are very hesitant to bring their kids anywhere in public, but especially to the pediatricians or primary care offices. And we would encourage parents to really take your child's medical needs very seriously. If they do need to go see their pediatrician, don't delay that. We have so many wonderful pediatricians in our community, and many of them have put a lot of safety protocols into their clinics so that they can continue to take care of your children. Another challenge that we see is the large decrease in immunizations that are happening throughout our community, even here in the Rio Grande Valley. And we encourage parents to continue to have their children receive those immunizations so that they can be safe and protected from the other things that are going around in the world and in the community as well. So just know that with the increase that we are seeing in COVID-19, please also keep your children safe. We are ready for them, but we are seeing a higher acuity of patients coming to the hospital, even in the children. So please take care of those needs quickly.
Absolutely. And think one thing we've seen about this virus is that no one is immune from getting it. I mean, we see people of all ages, and a lot in the young population. We've noticed that that number is increasing. So thank you for that. Are you having to use your children's hospital at this time to house any of the adult patients?
At this time, we are not, but we have let the county leaders know that if we do get to a point where our hospital beds are needing more capacity, that we do have some beds available that we could coordinate with the county to make available for the public need.
And one last question. If a patient ends up in a hospital for COVID-19, what efforts are being made to keep the family apprised of the patient's status? You know how important that is here in the Valley, where people love to be able to go see their relatives in the hospital and be there with them at all times, but we know that's not possible with COVID-19. So what are you doing to keep families apprised?
Yes, and my heart goes out to any family who's had a loved one in the hospital right now. It is a challenging time. Communication is a top priority for all of our medical staff and our nurses and everyone in the hospital. So we have worked really hard to make sure that we provide resources to families to be able to communicate digitally. We use a lot of FaceTime. We'll use Zoom. We'll do anything we can to make sure that even though your loved one is in the hospital, they can see you. And that is so helpful for their healing process, and we want to make sure that you have that contact. We've even gone as far for our inpatient rehab as making sure that we bring the family to a place outside the hospital, and we'll bring a therapist down and train them on ways that they can take care of their loved one after the hospitalization. And our team within the hospital will digitally train them and show them exactly how they can be able to take care of that person, well after they've been within the hospital. So a lot of innovative ideas and trying to make sure that everyone is safe and communicated with very well.
Thank you. Thank you for doing that. And thank you to all of you so very much for joining us today. We could do this much longer, but I know our time is limited. I think we want to make sure, though, that that the public walks away with the message that we have to all be role models to each other, and that especially to our children and our teenagers, and that we need to practice social distancing. We need to wash our hands, and we need to make sure that we wear our mask and do other things that are going to keep us safe. So thank you again so very much on behalf of the Edinburg Chamber, and stay safe and well.
Thank you again, Veronica, for that. And I want to thank the panelists for being here today. We understand, this was we're in the heat of the moment, and your schedules are very busy right now, but we appreciate you helping us with this message to our business leaders and to our community. I also want to thank our board of directors, who are currently not here, but I want to thank Hiran Govin, who is the current president of the board, and of course our long list of board members that work voluntary hours to help put events like this on for our business community. Next, I also want to bring up Mr. Mario Liscano and thank him for helping hosting today is event, and he has a message regarding some other efforts that we continue to move on, and which is very important for this community at the current time.
Thank you, Mr. Ronnie, and thank you to everyone that continues to view us out there and the importance of the message that we have provided today. We give special thanks to Ms. Veronica Gonzalez, who has provided us with this leadership that we are providing the community with the awareness and information that this Public Affairs Committee was meant to be. At this time, I'd like to ask Senator Eddie Lucio to come and join me, because we continue through the pandemic, we still have our other needs in our community. I'm going to ask Senator Lucio to please hold this up. And today, we are taking something that is very important to us, which is the U.S. Census. Because we are here providing efforts for our community, all the CEOs, the healthcare systems that are presented today will be included in a challenge that they have accepted and will be finishing on August 25th. The challenge will be to make sure that all our employees at our healthcare system, all our frontline workers, are being counted. And as each one of them, we thank them for agreeing to this challenge. We thank them for agreeing to participate in our community and be counted, because of the importance of education, infrastructure, and healthcare. And with that, the challenge will be finishing up on Friday, August 25th, when we will all come back together again and provide the numbers to ensure that we have everyone in our healthcare facilities counted for. But with that challenge, and because we had both our senators that were participating in this event, we want to make sure that they will be receiving the Senator's Cup. The winner of the healthcare system that has the most of their employees will be receiving the Senator's Cup. And of course, whoever gets named and whoever wins this cup will be the champion for 10 years, until the next census, of course. But thank you so much. Thank you, Senator Lucio, for everything you do and your commitment to our community. We thank Senator Hinojosa also for supporting us. Our incoming president, Ms. Veronica Gonzalez, thank you for all you do. Our Edinburg Chamber of Commerce Board of Directors, our City Council and EDC. We thank you for taking the time, for providing this time for us. If this is the manner that we're going to pass the message, then we will take it. Please be safe. Don't forget to wear your mask, wash your hands. Have a good day. And on behalf of the Edinburg Chamber of Commerce Board of Directors, we appreciate you and your continued support. Thank you.